My name is Ricky. This is the second time I've been to Egypt with the Institute. It has been an amazing experience, not just for me, but also for the doctors and spouses who have attended. I have seen the doctors grow and blossom with this experience. They have come in a little nervous, not knowing what to expect, but after a few surgeries, I've seen their confidence and experience grow along with their knowledge. The doctors have come to me with their experience and excitement of their adventures. Many are planning return trips with us in the future.
This course has met more than my expectations because there's a lot of nuances in implant dentistry, and with Hannah being next to you and kind of showing you where you could go do it better, it's been very positive. So now I have a better feel for even the basic cases, and also since I've been doing the more complicated cases, I feel like I can tackle those in my own office. The whole tour experience here has been great. Hotel accommodation has been wonderful, great food, great people. You know, I'm just happy to be here in Cairo. It's been a great cultural experience.
My name is Samir Ibaid. I am a full-time practicing endodontist in San Rafael. And the way I got introduced to this course was Dr. Hannah invited me in 2010 or 2011 to give an implant endo lecture, whether we should save the tooth or proceed with a dental implant. And that was a very challenging process in my mind, because in my mind it came very clear: if the tooth is savable, save it. If the tooth is not, an implant is a much, much better choice than anything else. But how do you communicate that to the crowd? So I told Dr. Hannah I'll be more than happy to give you the endodontic insights of the whole procedures, and then people can decide on their own. So I've been with Dr. Hannah once a year talking to his group, endo versus implant, showing my expertise part of it, which is the endodontics, and things just work out as far as the treatment planning. Because if you know the potential of both sides, coming up with the right conclusion is always easier said than done, I should say. So I've been listening to implants, seeing them every day in my practice, working with Dr. Hannah for the last 10 years, made me want to see more. As I said before, I want to bridge the gap between seeing an implant on an x-ray, seeing it being referred, and what happens in the middle. So that's why I'm here today. I'm trying to find out and fill the gap, looking at the surgical aspect of the implant placement. And an eye-opener, to say the least.
I love the course. I was able to fly in for the first lecture part of it, where you learn about the histology of why we do what we do. Dr. Hannah and Dr. Kanya are very good at teaching the techniques that they've used, sharing their expertise on paper, asking all the questions. They actually let you do testing on the model, so you don't jump right into it, you get a feel for it. And now we're on day 2, just really exciting because we get to do the clipboard. We're actually working on patients, so you leave with not only the book smarts from the first day, but you also get to do the hands-on experience today with the real patients.
Hannah, of course, this study club is amazing for the general dentists who start to place implant, because the reason why Dr. Hannah doing like a step-by-step to the how to place implant, and then bone grafting, soft tissue management, everything you can learn from here. Well, and especially Dr. Hannah's study club has a lot of the live surgery, like more than 10 times. So it will be a good experience for you how to start to place implant at your office. So I just really recommend, to taking this course. And then also the lecture, and he has a lot of different topics to how to learn like a advanced technique, which is like the sinus lift, or like the lateral approach, or ridge split, a lot of things. So it will be enjoy to taking this course, and then it will be better your skill and then you can do surgery at your office by yourself.
I was a beginner implant placement doctor last year, affiliated with this study club, and I had very little experience with implant surgery. I did a lot of restorative, placing crowns on implants, but had never placed a single one, nor have I had any formal training. And within a year's time, I built up enough confidence to place single unit and even double single unit implants, and I've done so in my own practice since then. They have learned so much. For me, it was A to Z. And then, of course, at the end of the day, it becomes, how much access do you have to do it, in practice, and then, building up all the supplies needed to go ahead, and also the continued mentorship as you move away from the study club and into your own practice has been incredibly helpful.